So it's my pleasure to tell you about, briefly, this paper that we're hoping to come out with over the next maybe 6 months. This is a paper that, manuscript that was created by a work group of the Krabbe Disease Newborn Screen Council, and it was originally an idea of Dr. Fatimi. So shout out from the LCM directors meeting that as more states start screening for Krabbe disease, there's going to be a lot of clinical providers, neurologists and geneticists with less expertise in this kind of complicated condition. And the point of this is to put together a manuscript to provide sort of an A to Z guide to putting together a sort of a protocol or algorithm for an institution to screen for Krabbe disease. So here is our excellent work group members, and I really appreciate everybody's contributions. This is nearly complete. We have a sort of a near final version, which should be submitted very soon. And obviously hoping that we can get this published. The goal is for this to be directed towards, again, clinical providers, and particularly those with a little bit less expertise in Krabbe disease, like neurologists and geneticists. So we're hoping for a journal that is viewed by neurologists and geneticists alike. So we have several sections of the manuscript that you can see here. And again, to this A to Z protocol idea, obviously this is complex because of the urgency, which is perhaps a little bit different than many conditions, although there certainly is urgency about many conditions on the newborn screen. The idea of trying to get to transplant by hopefully 30 days of life can be a challenge. So we go through a lot of information about how to make this successful. So going through each of these sections very briefly, we start by talking about the newborn screen, just teaching a little bit about the Krabbe newborn screen, the addition to the ROS cytosine numbers for the different forms, as well as a very brief, this is really geared towards infantile Krabbe disease and the protocol for follow-up of IKD, since that's the most urgent. But we've just very briefly kind of go through the subtypes of Krabbe disease and the importance of that rapid evaluation. We want clinical providers to get the families in within 24 to 48 hours of the initial referral. So considering this like a, quote, stroke code for any of you who are neurologists out there, or a very, very urgent or emergent neurologic situation or genetic situation. We go through some of that initial testing and what you might need, and obviously this might be slightly different based on state. We also highlight the difference between cytosine in red blood cells and in dried blood spot, which can be a point of confusion for people. They have vastly different ranges. So it's important that people are able to understand the difference between the cytosine done on dry blood spot versus red blood cells, and when might be appropriate to do, which. We then will go through a brief discussion of the interpretation of Gaussian molecular genetic testing, and this isn't like a compendium of all the genes or anything like that, but just a brief discussion of the testing in general. The bulk of the article is around preparing to receive the referrals, communication, and urgent testing. So we sort of have these 5 main components to the follow-up protocol. The first one, again, being trying to set up a way to get these referrals urgently and get the families in within 24 to 48 hours. We go through, you can't read the slide here, but this is just an example of 2 of the rows on a much larger communication table. And what we do is we try to give little excerpts of ways that clinicians might be able to explain the different aspects of following up a Krabbe disease newborn screen, and some notes and suggestions. So here we're describing a little bit about the natural history of Krabbe disease and introducing the possibility of stem cell transplant. This is just an excerpt from a section on informed consent where we go through the importance of providing sort of candid information around transplant, its potential benefits, as well as limitations. So something that's very, very important in this high-level discussion. In terms of urgent testing, we give a table kind of similar to our recommendations, our previously published recommendations table as to what kind of neurodiagnostic evaluation should be done. We recommend for IKD admission to the hospital for an expedited workup and then provide the different testing that should be done during that workup. We also include, if presuming family wants to move forward with a transplant evaluation, we include some of the evaluation points for that urgent testing that might be part of transplant evaluation. And we talk about a little bit earlier in the manuscript the importance of connecting with a transplant team as part of the preparation. So really, the goal is for the providers to be reading this paper before they get a referral for IKD. So that way they can prepare well, they can connect with the transplant team and have everything ready to go if an individual is identified. Finally, we talk about the importance of a specific plan around insurance, obtaining insurance authorizations, and that there needs to be team members specifically ready to do this, and we're providing as a supplement a template for a prior authorization letter that includes an excerpt for out-of-state transfer as well. In the next section, we go through treatment of Krabbe disease with most of what we're talking about centered around stem cell transplant. But we also talk a little bit about symptomatic therapy and direct them towards some great articles around symptomatic therapy and talk very briefly about emerging therapies like genetic therapies. We go through some of the real high-level papers that give us an idea about outcomes for transplant, and we provide a nice, concise summary of these outcomes that can help inform these providers' ability to have conversations with the patients and families, which is really important. And then finally, we talk about the importance of collaboration, and we bring up the Krabbe Disease Newborn Screen Council and how we can be available, the members of the council can be available to help any clinical providers or state lab individuals to understand and interpret results and figure out next steps, et cetera. So that is just a brief overview. I just wanted everybody to know that hopefully this will be coming out over the next 6 months or so. And I think this will be a great resource for providers, clinical providers at different institutions who are preparing to receive referrals for Krabbe newborn screen to set up their centers and have success in getting these babies the outcomes that we're hoping for. So thank you. And please, for whether you're a state lab individual or at a certain institution, once this comes out, I'm sure Anna will let everybody know and provide links. So sharing this with the providers at your institution will be helpful.